Well, good evening to everyone. I think in the interest of time and with respects to the program this evening, we should begin. I want to welcome you all here to St. Paul's Hospital's Own Your Own Health Community Forum. I hope everyone can hear me. If you can't, please just raise your hand and let me know. My name is Philip Lee. I'm a specialist in geriatric medicine, and I practice here at St. Paul's Hospital as well as out at UBC Hospital. It's my distinct pleasure to be here with you this evening to act as moderator and to introduce our speakers who will be able to present for you in just a few minutes. Today's topic, as you've heard, is in the themes of Let's Talk About Healthy Aging. And what we're going to have an opportunity to do is talk about the topic steering clear of the F words this winter. And we're going to be talking and focusing in on flu and falls. I think you'll all agree with me when I say that this is a particularly relevant and timely topic to be covering at this point in time. After all, there's lots of concerns about the up-and-coming flu season, and we hear about this all the time in the media. I think this is a wonderful opportunity that we have today with two experts in the field of geriatric medicine. I will be introducing Drs. Janet McElhaney and Wendy Cook in just a few minutes. But before we start the program, I've been asked to say a few words about the actual community forum events and share with you a bit of background. These sessions are held every third Wednesday of the month, and they represent an opportunity. It's an opportunity for us at Providence Health Care to share with you some important healthcare topics, to talk about the research and education that occurs within Providence Health Care. As participants this evening, you will have the opportunity to listen to the presentations, but what we also want to do is have an opportunity to hear the questions from you. You are going to have an opportunity to write down your questions, which will be collected after the presenters have presented their talks. And what I'll be able to do is ask these questions of the expert panel on your behalf. We only ask for two things. If you could perhaps keep it to one question per piece of paper. It doesn't mean that you can't ask more than one question, but one question per paper, it would be very helpful. And the second thing is, if you could make the question as clear as possible, what I'll be able to do is hopefully interpret the question and ask it as accurately as it was intended to be asked. So I would just ask you those two things. For your information as well, this session today will be videotaped and will be captured as a video podcast. This will be available to any friends or family members who were interested in the topic but not able to be here this evening. I will just give you the website now, but we can also have other ways to communicate that to you. It's www.phcmedicine.ca. If you click under the Public Forum tab within that website, you'll be able to download this podcast as well as previous podcasts of other sessions that have been presented. Of course, the website is www.phcmedicine, all one word, .ca. For any of you who have supplied your email address, we can also email you this link as well, if that helps. And if you have any other questions, please approach any one of us after the talk, and I'm sure we'll be able to share that website with you again. I would like to thank BC Hydro for their generous support in making this mode of dissemination of information available to us. It's certainly a novel way to get our message out. I will now introduce the speakers who will each spend about 15 to 20 minutes presenting on their area. Afterwards, as I said, we will open it up to the question and answer period. Please also feel free to stay after this evening's formal events for some refreshments and some time to mingle out front in the foyer. I will also mention that the next presentation will occur on November the 18th, and that will be on eating disorders, what they are and what can we do. There is also a handout out front that lists some of the details of that talk, so I would encourage you, if you're interested, to please pick that up, or if you know anyone else who's interested, please spread the word. So without further delay, I'd like to take this opportunity to introduce our two speakers. The first speaker that I'll speak on is Dr. Janet McElhaney. Dr. McElhaney is a professor of medicine with the University of British Columbia. She holds the Alan M. McGavin Research Chair in Geriatrics and is the Physician Program Director for Elder Care Acute Services. She's the division head of the Division of Geriatric Medicine at UBC, Providence Health Care, and at Vancouver General Hospital. Her research focus is particularly interested in the aging immune system and how it impacts the response to influenza. She's done a lot of work looking at how the vaccines can protect against influenza as well. So you can understand why she would be a very important person to have speak on the topic of flu. Her research is supported by the Canadian Institute for Health Research, the Michael Smith Foundation for Health Research, and the National Institute of Health. She's an advisor for the European Scientific Working Group on Influenza and on the advisory board for the Influenza Vaccine Project. This is a PATH project that's supported by the Bill and Melinda Gates Foundation. Our other speaker is Dr. Wendy Cook. Dr. Cook is a clinical assistant professor with the University of British Columbia in the Division of Geriatric Medicine. She holds the prestigious Physician Scholars Award through the Providence Health Care Research Institute. She's not only an excellent clinician, but she's also published in the medical literature on falls in community-dwelling seniors, as well as older adults with chronic kidney disease. Dr. Cook has been involved in the development of a falls prevention program, something that's been instituted in at least 3 sites within the Vancouver area. And in addition to this, she is currently running the Falls Clinic here at St. Paul's Hospital. So without further delay, I'd like to introduce our first speaker and have Dr. McElhaney come up here and talk to you about avoiding the F word.
Thank you, Phil. A very kind introduction. And thank you to all of you for coming out tonight. This is my most favorite topic to talk about. What I really want to point out tonight is what happens because the immune system weakens as we get older. If we look at, and this is the reason why I started studying flu 20 years ago, if we look at the serious complications of influenza, where this is really an illness that makes you really feel sick if you're young for a few days, this illness has a major impact in older people, and we see that 90% of the deaths due to flu occur in the older adult population. But even more importantly is that for every death that occurs, there's 3 or 4 hospitalizations, and I'm going to talk to you about what the impact of hospitalization is. And there's a little message around here about how to look after yourself in hospital as well, but I know that we would be better off if we could prevent the disease altogether, so that's really the point of putting forward this message tonight. I want to highlight, how many of you are confused with all the information that's coming out there around pandemic H1N1 and all this stuff? Okay, so, and you're like everybody that comes in for my flu studies. Pandemic H1N1 is a problem in young adults and children. And the reason is because people born after the 1918 pandemic all the way up to about 1956 have already seen this kind of virus before. So your immune systems have already been exposed to this, and we know that you already have antibody titers. We have antibodies to this strain that's going around right now. If we give you regular seasonal flu vaccine, we can stimulate those antibody titers, and we can take your serum with those antibody titers in it, put them into ferrets, which is the animal model for this, and protect them from getting pandemic vaccines. And there's other parts of the immune system that are brought to bear in all of this. But really what I'm talking about tonight, and what I really want to emphasize to you, is that it is really, really of utmost importance that you get your regular seasonal flu vaccine this year, okay? In terms of what to do about the pandemic stuff, and there's been some concerns that they're kind of saving the good stuff for the younger folks, that's not the case. Is that your risk is completely different than younger people, and you need the seasonal flu vaccine. So make sure you get that one. And if you ask me what I would recommend for my mother, I'll tell you about the other piece of it, which is hard for people to sort out as well in terms of the information that's coming out. So the other problem is that we have with the current vaccines is that these preparations, the way we make them right now, they're about 70 to 90% effective in young people. But in older folks, it goes down to about 30 to 40% effective. How many people have heard the stuff in the media? It's kind of been overwhelmed by this pandemic stuff this year, but how many people have heard this thing about maybe these flu vaccines don't really work in older people? How many people have heard that? Well, that's not true. They do work. And what they're particularly effective, so this is preventing people from getting an influenza infection. But when we look at protection against serious illness, which is the real problem, they're very effective in doing that. And we know that there's things that we can do to even improve them by the kind of work that we're doing in my lab right now. But the important thing here is that if you get vaccinated and you get the flu, your illness will be much, much less severe. That's the reason to get vaccinated. And we've actually shown that if people get that flu illness, the next year they have even a better response to the vaccine. So you can't go wrong by getting vaccinated every year. And the more frequently that you're vaccinated on an annual basis, the better protected you are. So there's no concern about going out and getting your vaccine every single year, okay? This is what this bug looks like under the microscope. And I don't think we've got a pointer here, but maybe I can make this thing work. Oh, here we go. So every year, this is the outside of this virus. And when we talk about the strains of this virus changing, it's just what's happening on the very tip of this thing here where the antibodies bind. And this is what we get all excited about. But there's a whole bunch of parts of this virus that are really important for stimulating the older adult immune system. But the way we make our current vaccines, they dump out all of this stuff inside the virus that would have been good for stimulating your immune system. And that's probably why these vaccines don't work as well. But they're all made to be more effective in young people. And what we have to do now is get a focus on how do we make more effective vaccines in older people. So I'm saying we're saving the good stuff for you folks, okay, rather than the other way around. And this slide is just to show you how flu makes you feel ill and why vaccines work. So you're in the grocery store and the person in front of you coughs. That has a sound to it, but it can't hear it out there. In the next breath, you suck in all that virus. And its job is to get inside the cells of the airways and start making a whole bunch of copies of itself. That's what we're built, is to replicate, so we make more of ourselves. So it becomes this race of these viruses replicating, and whether or not you can get those antibodies in to bind up that virus. And often that's not effective. The cells get infected and they get the little factories going in there. It strips off your lining of your lungs and causes pneumonia, and the inflammatory response to that. I'm on this microphone. Can you hear me? Okay, good. All right. Are you okay back there? Okay, good. So when these viruses set up these little factories, the antibodies can't find them because they can only see virus that's on the outside of the cell. And so what you have to do is you have to get these killer cells in there, okay? And what these cells are is they're turned on by all of those proteins we dump out of the virus when we make the vaccines. Those are the proteins we want in there. And those killer cells, when you have a cell in your body infected, it holds a little peptide, a little piece of that virus like a little hand on the surface. And those killer cells are running around looking for the infected cells, and they go in and they kill that cell. And that's how we clear virus from the lungs. And that's how you recover from a flu infection. So we're trying to make vaccines that really understand how to get those killer cells in there so that you don't get so sick. In older people, this whole mechanism may not work as well, and why we see the serious complications. They get pneumonia because there's too much damage before that weakened immune system can get in there and kill those virus-infected cells. And vaccines are the thing that we use to show the immune system what they're looking for, and they're out there in the body looking for those flu-infected cells to kill them. So this is the other challenge that we have, is that in older people, it's often difficult to tell the difference between a cold and when you've got the flu. In young people, in both age groups, if you get a cold, you mostly have a stuffy nose and sneezing, as you can see in that column there. In young people, a very different illness when they get flu. They get fever, they get headache, they get really bad muscle aches, and they feel just terrible. And it comes on all of a sudden like they've hit a wall. When you get into the over 65 population and the immune system is not so robust anymore, now you see that those signs of flu are more like the common cold, and so we can often get confused. And so this is the way to remember this. If you know that flu is circulating in the community and you get a cough or a sore throat that really just makes you feel like going to bed and lying down, that you just feel weak like that, you should suspect that that's flu rather than the common cold. Whereas if you get a runny nose and a sneeze and stuff like that, that's more likely to be a cold. But even for healthcare professionals, it becomes difficult to tell the difference between the two. So that's the way to think about it. So just to remind you again, if you get a cough or sore throat and just feeling really miserable and feeling a bit feverish, and you know that flu is in the community, you should be seeing your doctor about whether or not this is flu, or at least calling into the clinic as they're recommending right now. So this is the problem that we have in older people, is that in this usual aging group, chronic diseases are very common in those yellow figures there, and those things also cause people to have even more weakened immune system, and so they even need vaccines even more. And what we want to do is to understand that we vaccinate to try and protect as many. This is kind of showing you the spectrum of health in older people. So we get you as protected as we possibly can. But when you get a flu illness, what we're trying to do is that, and so has everybody heard drink lots of fluids and get rest? Well, I'm telling you, the other little piece of this is that getting rest doesn't mean going and staying in bed for days on end, because if you're one of these usual aging older folks and you take to your bed and spend most of the time there, whether that's in hospital or at home, you can lose up to 5% of your functional muscle strength, especially in your legs. And so you come out at the end of it. And what we want to do is we want to prevent that from happening in the first place, like that green figure there. I want to prevent you from getting you back to your regular state of health, but you become at high risk of this trajectory happening, so that overnight you went from one of those usual aging older people to somebody who is getting close to needing nursing home type of care. And I've seen this happen. One of my patients, I saw her in the nursing home, and she just had forgotten to get her flu shot that year. And she had been watching, football on Super Bowl Sunday down in the U.S., and the next day was with a tube down her throat in the ICU with flu. And nobody even recognized that it was flu because it's atypical, but it was really terrible seeing that happen to somebody that previously had enjoyed an active life. So the message here is make sure you get your flu shot. So what we know in older individuals is that there's not only a risk for of influenza, but there's really a great risk for loss of independence through one of these illnesses. So get your regular flu shot. Know that you're really relatively protected against this pandemic strain that's going around. And what we need to do is keep working to get even better protection against seasonal influenza. And when we have a pandemic that's due to a strain you've never seen before, look out. And that's what the research efforts are for. But we have, our results are showing that we can go in a direction that we're going to improve infection or improve outcomes of influenza by developing better vaccines.